Discover something new with consciousness. We all have routines and habits and generally approach a problem or situation in the same way. We learned how to solve a problem a certain way, but we never realized that there are possibly better or more efficient ways. In other words, there are some things you've been doing wrong your entire life without knowing it. Here are the most common myths about first aid and what you should do in emergency situations. 12. Rubbing a person with a fever with alcohol or vinegar. Rubbing alcohol on your skin makes your skin feel cooler. But this cooling doesn't help that much when you have a fever. In addition, alcohol can be soaked up through the skin. For small children and infants, using rubbing alcohol to treat a fever increases the risk of alcohol poisoning. Instead, try a medicine that reduces fever and contains ibuprofen or acetaminophen. Drink a lot of water, tea, or juice. Call your healthcare provider if you don't know what to do or if the fever doesn't go away. 11. Putting a spoon in the mouth of someone having a seizure or fit. This is one of the most common myths people believe about first aid. But it's so they don't swallow their tongue, I hear people say. Well, it's very unlikely you'd swallow your tongue in any situation. Technically, the tongue could relax and block the airway, but this is extremely rare. In fact, most epileptic seizures stop after a short period of time. Forcing an object into the mouth of someone who is having a seizure would only add more stress to the situation. Some people believe this myth comes from people trying to avoid getting blood on the floor when having a nosebleed. Correct first aid for a nosebleed is to sit the individual down and get them to lean forward, pinching the bleeding blood vessel against the inside of the nose to stop the blood coming. 9. You should apply ice to a burn. Applying ice to a burn is a myth that can cause further damage to the tissue. You should put the burn under cool running water for 20 minutes. This will help significantly reduce tissue damage, hasten wound healing, and reduce scarring. Please don't apply anything other than a proper burn dressing. Never apply butter, toothpaste, palm oil, potatoes, or anything else to a burn. 8. Apply heat to a sprained ankle injury. Sometimes physical therapists do recommend alternating hot and cold for certain types of injuries. Heat increases blood flow, which can promote healing. Cold reduces swelling. So the idea of applying heat to a sprained ankle may have arisen from. But in the case of a sprained ankle, the swelling is the problem you're trying to address. 7. Rub eyes to get rid of a thing that makes them itch. When you have a speck of dirt or some other small object in your eye, the feeling can be extremely annoying. You may want to rub your eye to remove the object, but don't rub your eye. Rubbing your eye when there is a foreign object in it can cause more damage to your eye. Tears alone likely won't be enough to wash out the object. Instead, rinse your eye with clean tap water. Get medical care if the feeling continues. 6. Coffee grounds can stop the bleeding. Coffee grounds make the wounded area harder to clean. That's why this is one of the common first aid misconceptions to debunk. Instead, you need to apply downward pressure with a thick and sterile gauze on the wound. Wrap the gauze around the wound when the bleeding stops. 5. Stick your finger inside the mouth of a person who is choking. If you do that, the airway will swell, and breathing becomes a challenging task for the patient. This could be an extremely dangerous step. Instead, bend the patient forward from the waist. Give them 4 or 5 back blows using your hand's heel. This will help open the airway and get the thing out of the mouth, causing the person to choke. 4. If someone has swallowed poison, make them vomit. It is better not to make someone vomit who has swallowed a poison, for example, bleach. Any substance doing damage on the way down to the stomach will do more damage on the way back up if you make them vomit. If the substance hasn't affected the airway on the way down, it may irritate the airway as the substance vomited up is mixed with stomach acid. Take the casualty and a sample of the substance they have swallowed, or the packet to amp E. 3. Put butter on a burn. If a person suffers a burn, their skin has already dried out. All the butter will do is add to the heat retention. It won't cool it, although it may initially feel like it. So put it away and head straight to the tap instead. The best thing to do is to use cool running water for at least 10 minutes. 2. However, this is not true and can be harmful to the person. Instead, it is recommended to lay the person on their back and elevate their head above the level of their heart to increase blood flow to the brain. 1. Remove impaled objects immediately. The removal of an impaled object can do more harm than good. This object puts internal pressure on the wound, helping to control internal bleeding. If removed, the patient risks continued bleeding that cannot be controlled externally. So, instead of removing the foreign body, put gauze on the area, place a clean rag around it, and seek medical attention.